Hey there, and welcome to Retirement Reimagined. I'm Tiffany Nyiri, Senior Living Specialist, and this is the podcast where we flip the script on senior living. Whether you're a retiree ready to take on a new adventure or just curious about how to make the most of your golden years, you're in the right place. Join me and our amazing expert guests as we dive into everything from hitting the road in an RV, getting your financial ducks in a row, exploring the perks of a reverse mortgage, or just figuring out how to link that smartphone to your car. We're here to inspire, inform, and give you practical tips to live your best retired life. So buckle up, tune in, and let's reimagine what retirement can truly be. Welcome. This has been something that I've been waiting for. Alicia Iglesias, MSPA-C, and she's going to tell us what that means. But we are going to talk about non-traditional hormone replacement therapy, male and female. Big topic right now. Big topic. So, Alicia, will you please introduce yourself and let us know who you are?
Thank you so much, Tiffany. My name is Alicia Iglesias. I'm a certified physician assistant. That's the PAC. I hold a master's in science. So that's where the MS comes from. Master's in Science of Physician Assistant Studies. So I am a physician assistant. I am also a foreign medical grad. Should I say that?
Yes,
I
absolutely.
am a graduate from UABC Mexicali in Mexico. So
Yes.
I have a double degree in international.
You are highly educated because typically, you get one in the US and that's it. But now you have two.
So it depends where I'm at. Yeah, definitely. Two different point of views. Absolutely.
And what brought you to the science of the medical field and what you're currently doing now in the US?
Got it. So I grew up in Anaheim. So I've been in the US my entire life. I actually am first generation to go to college. So unfortunately, college sometimes for those of us that don't exactly know the way that it works is very difficult. You make a lot of choices that you think that are going to be beneficial to you that in the end are absolutely not because you don't have the right guidance. You don't have the right journey that you should have taken or the right, how do you say, counseling that you should have. When you don't know, you make a lot of mistakes. And this is how I ended up in two separate countries doing the same. But I think in the end, it was very beneficial to me. The medicine that I learned, Mexico is very hands-on. You don't see a lot of imaging. You don't see a lot of, it's there. It's to those that have it, but they do not 100% rely on it. And it's not one of the very first things that you'll see when you have consultations in Mexico. Here, we are, things are different. The laws are different. We are very responsible for every single thing that you do. So there is a pattern of how you can be seen. You can't do C until you've been through A and B. And everybody that's gone to a doctor knows exactly what I'm talking about. I know
Pain
that I need an
in the
X-ray.
rear
I
end.
know, yeah.
Pain.
So it is very sometimes frustrating, but I think the way that the U.S. is handling medicine, this is what you have to go through. You have to do A before B. A lot of times, by the time you get to C, you don't even need it anymore. So that is kind of also in parentheses a hope that we do that. Hopefully, you won't need it because we don't want to expose you. We don't want to do all that, but at the same time, the institution is saving money. So I guess that it kind of I hate to say it, but it is a business, unfortunately.
Oh, yeah, insurance is a big business. And we're going to talk about something other than insurance and other
Absolutely.
than
I hope so.
traditional medicine
Mhm.
because I am currently in a state of I don't even know, medical need where I sought out your help. And we are going to be on the journey of doing exactly what we're talking about right now. And just for record, I'm 51, going to be 52, and it has absolutely started in my world. And we're going to talk about hormone replacement options, non-traditional hormone replacement options. And the key word there is non-traditional, correct?
Correct.
And because I went to my typical doctor, I did the A, B, and C, and they wanted to put me on this laundry list of non productive drugs, in my opinion, with a lot of side effects to my liver, to my kidney, to my body in general. It was not a road that I was going to go down. And I am not the only one. There are so many men and women in this position where we need science, but we also need our brain to go, okay, when is it the time to issue all these meds that they're pushing out from the big farm, or when is it necessary to have other options? Can you dive into some other options and kind of where I'm going with this? Can you bring me back?
Absolutely. So I do think that what you're saying is absolutely true. There comes a point where we start needing help. Um, I, in my practice, have seen, like, it almost seemed like everybody over 40. I have hair loss. I'm gaining so much weight. I'm trying to diet so much. I don't feel happy. My living situations are not so great. I can go on and on in regards to the symptoms that we have, and it almost feels like it plays over and over and over again with every other patient that we see in consult. So one of the reasons why I got into this was because of hair loss, and from hair loss, I just found a lot of other points that I was like, wait a minute, we can handle this with this too. We can do this too. Every woman over 40 that I can tell you in consult at one point or another complained to me about hair loss. So I, as unknowingly, went through IVF, lost my ability to conceive, and eventually went through IVF 8 years. When I finally was able to conceive and I had my daughters, exactly like to the day, 3 days of postpartum, shedding of hair. And so that's where it began. It began because I started treating myself and started finding things out for myself and figured out where I was and what had happened and what I went into early menopause, so many things that came up with that. So me being in my position, now seeing other people that are in the exact same position, going through they're literally telling me what I'm feeling and what I'm going through. And I was like, oh my God, I almost want to high five them. Like, I know, right? I'm feeling that too. We do. We go through the same symptoms. We go through the same problems. So there came the need or the desire to start to research it. So among the things that I found were testing of hormones that I personally, just like everybody else, went through traditional methods. They check your blood, everything's fine, everything's good, but no, it really wasn't. So this is where I found saliva testing for hormones. So in traditional medicine, there's no way anybody ever would have even mentioned it. I actually mentioned it a couple of times to a couple of the doctors that I had during that time. That we don't do that. And I was like, but this is what is happening and this is what it does. Can we order it? No, we don't order that. Can I pay for it? Can I pay for it out of my pocket? I really want to know. Can I do it myself? No, because that's outside of what your insurance, and we wouldn't order it. And I was like, why? Why is it not? There's no fine response. There really isn't. It's just like, it's basically like, no, I don't want to do it because then that means that I have to now go and research it and then give you the results of what it is. And then what if you want to do it again? Why are they going to do something that to them is unnecessary? Because they feel that we have
Blinders.
they have the answers to everything. And there's never, it's really rare. I feel that when you go to a doctor and you give them options of other stuff where they're like, let me research that. Let me write that down. Next time you come, we're going to talk about that, or I'm going to get back to you and figure that out.
Oh gosh, I have never had that conversation
No.
with a doctor.
Right? So
Never.
it's one of those situations where no, there's either no time, no desire, or they just don't believe in it. They just don't want to do it because it's not something that they do. So in traditional medicine, yeah, that was literally a wall. Just like hundreds and thousands of us that we go to the doctor, this is what I'm feeling. I'm having this. That's normal. This is normal. There's okay, well, it's normal, but I feel like I want to lock myself in a room, never talk to anybody again, and it's okay though, but that's normal. I don't understand it. I really don't understand it, because if it were anybody else, or if it were at a different age, or if it were at a different sex, it would not be seen that way. It would be, jolting, like, wait, what's happening? Wait, let's talk about that. Let's see where we can take this. But because it's you, it's your age, you're female, that's normal for you. That's expected.
Yeah. It just happens.
Yeah, it happens. So you need to accept it. You need to learn how to live with it. Just live with it.
And it's funny because if a big group of people have the same thing,
like only half of the population, only,
you would think there would be a little bit more investigation, a little bit more, hey, there's something here.
Something's happening.
Something's happening.
Why is it? What is it? Or what options do you have at this point in time? What are your options?
I had the hair loss too. He's like, oh, it's normal. It's not normal.
It's normal because you don't have your hormones aren't there. But I mean, how about let's address that? Let's talk about that, because they already know that that's part of that conglomerate, that group of symptoms that happen to us, that in many people and in many women, this is our highest suicide rate age. Like it's definitely dominating in this, what we feel, what we go through, things that happen to us during this time, a lot of divorce. And a lot of divorce with things that you say, like, remember that, and I wanted to have that, but I don't feel it anymore. So now what do I do? And how do you convince somebody else to understand what you're feeling? And when they do understand, do they really understand, or is it just like minimizing? Like, okay. So a lot of things happen to us during this time, and those things are impact our life so much.
And I can see
Forgetfulness.
that, yeah, I can see the whole divorce thing because, a lot of this that happens to ladies, again, between the ages of 40 and would you say 60, 70,
Mm-hmm, mm-hmm.
you lose the desire. You lose certain things in your body that don't allow you to have sexual intercourse anymore. And to our boys, this is important. And to us, it's important.
Absolutely.
If you are missing that in your marriage or your relationship, it's huge. It's
It
just
is.
huge.
It
And
absolutely is.
I think we could stop a lot of divorce with just that one.
In traditional medicine, when you request or when it finally comes up that, okay, let's check your hormones, they don't want to check it because they know what they're going to see. It's going to be lower. So again, a cost that possibly could be set aside. So, okay, they send you to do your lab test, and then you get your lab test and it's like, oh, this is fine, or this is low, or this is wherever. And then it's like, okay, so now what? Now where do we go from here? What are my options? Well, there's over the counter things that, by the way, a lot of over the counter things work fantastic. They do sometimes suppress some of the symptoms that we have, the hot flashes, the memory loss. They do, and some of them do address it, and they are good. But why aren't they regularly, like, if this works and this, how is there not research to work on that to see if there's something that the majority of women, if that's what you're feeling, then that's what is that something that we should all be taking?
Mhm.
So there we go. We go to a lab to go do a test, a blood test, which many of times I think providers don't understand that our hormones are linked to proteins. So when we get a blood test, we are not actually measuring the amount of hormones that are actually circulating in your system. You're measuring what's free and what's not free, what's attached to the proteins. So now you have this larger number, and they're like, okay, everything here looks great. That's not the case with saliva testing. Saliva testing is beneficial in various different aspects. Number one, there's no stick. So those of them that are just petrified that, oh, they just can't handle the thought of blood draw because of the stick, now you have an option because you can do saliva testing through hormone testing through saliva. They're usually kits that either the doctors will give you or that you will receive in the mail. Read the information the day before. It's going to tell you how to take it. There's certain things that you need to avoid, like you can't chew gum, you can't do certain things so that your concentration is good in your, can't brush your teeth, things like that.
I'm salivating right now just
I know,
thinking
I'm just
about
thinking
doing
about
a
it, me too.
test. Like
It's
I'm
just something
ready.
I do
I'm
this all
ready
the
to take my
time.
test.
So you get your test, read the instructions. They're usually going to have a couple of different tubes to where you're going to collect saliva from. Some of them come in like little plastic jars. They're small, and they're like with a pipette. And with the pipette, you basically fill the container of saliva. They tell you what time to take it. You do those collections at that time. You put them together. I think they are freeze packed. Some are freeze packed. I think the majority are probably freeze packed. Call the delivery service. They pick it up and they take it. Again, the test is non-stick. Two, you can do it at home. You can do it at any time. You can choose your time. Nobody's there to bother you, and you send it out by mail. The results are then sent to your provider, or they're sent to you depending on what's set up with your provider, and then you go over the results. So saliva testing has a lot of good benefits to it. Again, that's not for everything, but in this case for hormones, that's what I do. I do hormone testing through saliva.
You mentioned to me in one of our other meetings that you could do two blood tests, one day and one the other day, and they would both come out a little bit different.
Absolutely. So every day your body is different. Your body does not have the same experience day after day. It doesn't have the same amount of water. It doesn't have the same food. It doesn't have the same stress. It doesn't have nothing. That's why two identical twins will never be exactly the same. That's why they're two separate people, because their experiences to the world and everything else will be different from the moment that they are conceived. So the same happens to us throughout our life. Our diets might be different. So all of those things, they're that little grain of salt that might make things different.
Yes. Yes. So if someone is experiencing these symptoms and their doctor is not as helpful as the doctor you would think would be, they can come seek someone like yourself. How do they find someone like you that is an alternative medicine
So
advocate?
the how we got into this also, like, that this is our testing for us to do bioidentical hormone replacement. Bioidentical hormone replacement is not hormones in the way that we have them, that way that we see them in Western medicine, which is, the birth control, the pills that we would normally take to help us balance hormones. Unfortunately, I think we are in a very good place, but we have definitely a lot to learn from hormones as far as like for birth control and so on. A lot of the medications that we may be given at a later age can cause cancer of the breast. They can cause cancer of the uterus. It can cause cancer of this. So I don't know about you, but when I hit my 50s, I kind of don't want to touch any of that stuff anymore. So how can I treat myself if what you're giving me or what you're offering me has the potential for cancer and I have cancer genes in my family? The majority of us are going to be like, hold off. No, this is definitely not what we want to do. So now what options do we have? Now we have the over the counter. Is that it? Is that all that we have now? So bioidentical hormone replacement is, I think that we kind of touched on this before because we both like, we were like, if we were seeing a star within each other, that we were like, it is definitely a lifesaver. It's definitely an option. There is some research on it that kind of concludes that it is just at the same level as the Western medicine to produce cancer, but take a very good look when you find literature of this and see who wrote it. Who wrote it and where is it coming from? And how many and what were the specimens and how many and at what age and all of those things. You're going to notice that the Western where I have seen have come from big farm. So I don't want you to do that because bioidentical hormone replacement at this point in time doesn't go through their hands. So I feel that it's given a bad rap. They're not making any money off of it.
See,
so it's given a bad rap.
The old age, all the money, and who is benefiting from this? So the only people that are going to benefit from what we are talking about right here is the actual patient, the human. The human is going to benefit from knowing this, and it's just kind of swept under the rug, unfortunately. A lot of ladies and gentlemen, we'll dive
they
into a little bit of that too.
never know about it, and then when they try to look for it, then they're seeing some things that are negative, and because it's not in Western medicine, they're going to put it down because the majority of us are afraid of it. They don't know what it is. They don't know how to do it. Their doctor says that no, that's not even, an option, or no, that's not real, or good luck with that because who knows who's going to do it. Yet there's hundreds of doctors that are working with it and where it gives absolutely a benefit. We're not here saying that we are going to stop time and that you are going to rejuvenate with anything. What we are saying is that yes, the aging process is coming and yes, it's going to happen, but it doesn't have to be from 100 to 0. It can be much, much slower than what it is right now, even with hormone replacement. So will it happen? Sure. But there needs to be a balance. It can't just happen from one day to the other, which honestly, that's what it felt like to me. I tell my husband that all the time. It feels to me like if one day I woke up and the lights never came on, that was it. It was just dark. I never had the opportunity to be able to adjust from that the day before to that dark day. It was difficult. It has always been difficult. And it continues to be difficult. But I do honestly believe that a lot of times we just want to know. It's not so much like, is it or is it not? Is it or is it not? Like, I want a medication, or sometimes it's like, I just want to know. And if you want to do testing, you're more than welcome to find our website. So you have a couple of options at Virtual Pro Telemed is one of the options where you can request testing and it will be sent to your home. You'll do the testing at home, send it in, and then we will have consultation for the results. If you would like to have bioidentical hormone replacement, there are pharmacies that will deliver from the pharmacy. So depending on your results, so we can order it from the pharmacy and it will be shipped to your home. So if you're interested in that, that's definitely an option. There are all besides the topicals or for the bioidenticals, there are also pellets now. So we can have testosterone pellets, estrogen pellets, so which obviously you would need to find a provider that is inserting them and somewhere in your area. But as far as hormone replacement, it is definitely possible through pharmacies, compounding pharmacies that will dose the medication and send it to you. So,
And this is not a difficult thing. This is not something that doesn't exist. Unless you are in a city that maybe doesn't have a compounding pharmacy, that's okay. They can still make it somewhere else and send it to you.
and send it to you. Correct. Correct.
Yeah.
Not difficult at all.
And so you're talking like a cream or the pellets that are like under the skin a little
Under
bit
the
that you don't
skin.
even feel, or then time
Correct. They
release. Okay.
dissolved with time release. Correct. They're time release
Okay.
pellets. They are, so once you start with bioidentical hormone replacement, just like with any other medication where we want to check your levels, your labs will be repeated over a certain period of time, depending on what you're doing and how long you've been on it, and adjustments are made in that way.
And for our gentlemen, so their testosterone would be low and it may have been fine, 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 and then it may have dipped, or they may not have known that their testosterone was low for a very, very long time because they're just a go-getter and they're doing their thing. But had they had an average, which is set by insurance companies, from what I'm learning, because some of them look at your test and go, you're fine. And a non big insurance company will be like, oh, you're low. So, same test, two different insurances will have two different ways of reading your test.
Correct.
Which I find fascinating.
Even between different pharmacies, you'll have different results. So men, just like women, also some men go through andropause where you have a decline in testosterone. Now, with men, we do have a couple of other concerns because just like with women, when you replace certain hormones, you're increasing the possibility of breast cancer, uterine cancers. With men, that's also a concern. So prostate cancer is also a big concern because too much testosterone can stimulate the prostate to grow. So with men, again, just like with women, we want to assure that we have good levels. We want to make sure that they're aware of, possibly they weren't aware and they have had low testosterone their entire life, and now with that little bit of lower, now they feel it, or maybe they don't feel it at all. And if they don't feel it at all, they're like, no, it's low, but I'm good. Like everything's working the way it should. Everything is, and you're like,
because
let's stay
it's
there.
not too high, because I've had conversations with gentlemen are taking a lot and they're like pumped, and I'm like, dude, you need to lay back on that, it sounds like.
Yeah. So a lot of secondary, that, which is, we're not like, we're not bodybuilders, definitely not at this age, but there's, just like everyone, there's always a potential for abuse. You got to try to catch those, but what do you tried your best and you give what the best advice that you can. Some people are just going to do whatever they feel is appropriate for them. Those are definitely not the people we're talking about today.
No, for our conversation, it's about, I'm all, okay, so this is what I do. So I'm in the world of finance, funny enough. So I do reverse mortgage to help people live their best life. This is why I interview people to help live our best lives. When you get 50, 60, 70 years old, we want our health, we want our memory, we want to be sexually active, we want to not be snippy, and we don't want belly fat if we are working out and doing the right things. We do not want that stubborn belly fat, and that's a
absolutely agreed with every single point that you made.
goodness.
And then to top it off, we all lose our hair. Like women lose their hair, men are much more than women. We also, there are medications, topicals that can help with hair loss, which we also do through the website. But we do general practice in general. So we do a lot. But because I have had the opportunity to go through this because of my infertility and because of my IVF and because of all the problems that I had secondary to trying to fix all of that, it has been a very long journey, but thankfully it has brought me here. And now I have a voice to, to hopefully speak out to someone that might be in the same situation that we are. I feel that a lot of times, me as a physician, I don't go dressed in my white coat to go to consult. I go as a patient. And I see a lot of times where I'm like, this is why I end up with some of the patients that I do, because of your style of practice, I'm going to say, because there was no information given here. You basically just told me what's wrong with you and what am I going to do, and this is what I'm going to do. Peace. See you later. And I'm off to the next person. And you start asking questions, or bothered, and no, like what? Why? Can I do a saliva test? What? Wait, what? We don't do that. So and as a physician. And when I think to be taken seriously a couple of times, I had to literally push my weight and be like, yeah, I'm also a clinician. I practice down the street or whatever, or wherever I do. I'm a PA. And then all of a sudden it changes. Okay, so let's talk. Oh, you're willing to talk to me because I know the field, but you weren't willing to talk to me as a patient. There's 20 people behind me. You're going to talk to them
Same
like you just
thing.
did?
Yep.
So I get it too. I get it too. And unless it's somewhere where I feel like I need to put it out there so that we're talking in a little bit of a different language, I get the same treatment that everybody else does. Yeah, it's not fun.
Well, it's going to be interesting because I meet with my endocrinologist tomorrow and I have questions.
Now I have a lot of questions. Yeah.
I have questions. Well, I had them written down before we met because you and I had a little pre,
Hmm.
but the saliva test. So I will probably do a follow up to this and report back on my endo and talk about all of that and go from there.
Fantastic. I can't wait to hear what they tell you.
You'll be
Yeah.
the first. You'll be the first to know. In fact, it's on video, so I'm actually going to have it recorded. It's a telemed. So
Fantastic.
yeah, so I will record that and see how that goes. But okay, so you have a site. People can do it at their home. It's reasonably priced.
Yes.
Obviously, insurance is not going to cover this unless you can get your general practitioner or your endocrinologist or somebody to,
To order it. Yes, absolutely. So that would be definitely a way to save yourself some money, is to request it from your primary care, or like in your case, your endocrinologist, anybody that or your GYN, anybody that's going to listen, that's going to take some time and to check it. If they're willing to do it, great. If not, we do not deal with insurance at all, because
yeah.
insurance, again, like I mentioned in the beginning, will limit. They're like, your hands are tied again. So here we are now. I want to practice medicine, and then I go into practice, and like the insurance said no, and the company and the said no, that you can't do that, and then over here you can't do that, but then you can, but you have to do A, B, C, and D first, and you're like, here we are again. This is our health. This is how we're managing medicine nowadays. And I didn't want to bring it up because it's going to draw up this huge political thing again,
No,
because things are
I
so
think
weird,
everybody knows. Everybody knows they're not
strange.
getting their answers from their medical doctor.
Mm-hmm. Mm-hmm.
So, okay, everybody, we're going to have Alicia's information, Facebook, TikTok, Instagram, plus the site that she talked about where you can go to. Book a call with her. It's all you and her talking. And that's what we need to thrive in this world we're in right now. I mean, everybody's living longer. We're basically healthy, but we've got these little things that we would like to fix.
Absolutely. Or at least know, right? I think that a lot of times, like, I just want to know. I just want to know, because if I knew, I could take care of myself, or I can assure that is precisely what's causing this. So now I know, okay, now I'm good. So now I can work on that point specifically.
Yes, 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 yes. Sorry, I have some outside influence here. Anyway, the boys might cut that out.
Yes.
So, the idea behind all of this is that there is hope. There is someone that will listen to you. There is someone that you can get one on one information. And again, live your best life. This is all we can all hope for in our second half of our time here on this beautiful earth. And I don't know about you, but I want mine to be awesome.
Mm-hmm.
So,
Mm-hmm.
and I know my husband would like that as well. So I think we need to become a team, and we need to seek out people that can help us. And I'm so happy I got introduced to you. So we're gonna, like I said, we're gonna list everything. Any closing remarks that you have for us?
I would say, as far as for me, I think a big factor is taking charge and trying to be considering that there's other things out there besides Western medicine. What only things that you hear from when you go to your doctor. There are other options out there. There are holistic medicines. There are a lot of other things that we can do. I think just stay alert and find out what you can do and what will help. You don't have to suffer through everything that you're feeling. It's very likely that it will eventually come on, but it can come on at a rate where it's less, where you're not, where it's not taking so much from you, where you have time to adjust to what's coming. What more could we want but to have a more mentally healthy, physically healthy life? Yeah, it's
Yeah.
there.
Yep.
There's.
So excited. Thank you so much for coming on. I appreciate it.
Thank you,
And
Tiffany. Thank you
Yes,
for having
yes.
me.
Oh, no, that was so much fun. Thank you all for listening, and we'll be back with another podcast. And I will also do a follow up with my endo, which will be really, really fun. Thank you for listening, everyone. Take care. Thanks for tuning in to Retirement Reimagined. I hope today's episode gave you some great tips to elevate your retirement. If you enjoyed the show, be sure to subscribe so you never miss an episode. And if you found our discussion helpful, please leave a review. It helps others find the podcast too. Curious about how to unlock new financial opportunities in retirement? I'd love to chat and explore how we can make your golden years even brighter. Until next time, I'm Tiffany Nyiri. Keep reimagining.